Good morning, everyone. Not your average Wednesday. We have one earthquake and several aftershocks this morning. 17 new cases to report overnight, 9 of which are linked and the remaining still under investigation. Only one of the new cases was in quarantine during their entire infectious period, and at least 11 spent part of their infectious period in the community. There is still investigation underway of these cases, but the potential risk from the cases announced overnight, particularly the number that have been infectious in the community, is of concern. Hospital numbers have increased slightly to 12 currently hospitalised and 2 are in intensive care, both requiring ventilation, and neither of the individuals in intensive care are fully vaccinated. Testing numbers are a little low at 1,988. So again, if you have any symptoms, please come forward for testing and do so straight away, please. We've had too many people waiting days and days with symptoms before coming forward to get tested. If you've got symptoms, the best thing that you can do to protect yourself, your family and friends and the broader community is to come forward for testing as soon as possible. ACT Policing and the New South Wales Police Force have been joined by the Australian Defence Force in a series of major border crossing patrols around the ACT. So this is a reminder to everyone that you need an exemption to travel into the ACT, and there will be active patrols between New South Wales ACT Police and supported by the Australian Defence Force. COVID-19 business compliance teams continue to be active across the city. Compliance is generally good, but where it is not good is in the one consistent area that we have been repeating nearly every day now for the duration of this lockdown, and that is mask wearing amongst employees in business sites. So our compliance teams will continue that focus, continue to remind businesses, those who have already been reminded will not be shown the courtesy of further reminders on this point. It's just so frustrating for everyone who is doing the right thing to see that we still have workplaces, businesses, where mask wearing is not occurring. On the vaccination front, a little over 81% of the population have now received their first dose. Now that percentage continues to climb daily, and based on the forward bookings we have for people under 40, is now on track to exceed 95% of the ACT population. Around 56% of the population are now fully vaccinated, and again, based on second dose bookings, this too will exceed 95%. So it is clear that Canberrans want to get vaccinated, they are signed up to get vaccinated, and a more vaccinated Canberra is a safer Canberra. The ACT government has today announced that we will hire an additional 90 nurses and midwives into our public healthcare system as part of a $50 million investment in next month's ACT budget. Our local healthcare workforce has been there when our city has needed them most. Many have made significant personal sacrifices to support other Canberrans throughout the pandemic, providing tens of thousands of COVID tests and vaccinations over the last few months. I speak for all Canberrans in thanking our nursing workforce for their support throughout the pandemic, as well as the doctors, midwives, allied health professionals, in fact the entire local healthcare workforce who have gone above and beyond to support their community in this most difficult of times. Thank you to everyone who has done so much for our community. Minister for Health, Rachel Stephen-Smith, is here today to provide some further details on this very significant ACT government investment in our nursing workforce. As I mentioned earlier, a magnitude 6 earthquake occurred this morning at around 9:15 a.m. northeast of Melbourne. There have been several aftershocks. The tremors were felt across Canberra, and the Emergency Services Agency call centre received many calls this morning. At this stage, we have no reports of any significant damage within the ACT, but the Emergency Services Agency is ready to respond to any incident that occurs. So for those who've joined late, a quick recap: 17 new cases overnight, 9 of them linked, unfortunately only 1 in quarantine during their entire infectious period, up to 11 infectious in the community, with the remainder still under investigation. 10 people are hospitalised and 2 on ventilation in intensive care units. And again, as always, our thoughts are with the families of those people. I'll now invite the Deputy Chief Health Officer, Dr. Vanessa Johnston, to provide an update on new cases and epidemiology, and then the Minister for Health, Rachel Stephen-Smith, will provide an update, particularly on the recruitment of new nurses into our health system. Thank you.
Good morning. I'm Dr. Vanessa Johnston, the Deputy Chief Health Officer for the ACT. The total cases for this outbreak now stands at 658, with 17 new COVID-19 cases notified since our last update. So we continue to see more people recovering, and our total number of recovered cases is now 436. So that's 22 more than yesterday. Our team continues to manage 222 active cases. Of the new cases today, I can confirm out of the 17, 9 can be linked to known cases. Indeed, all of these 9 are household contacts of known cases. Of the 17, 1 was in quarantine during their entire infectious period. Out of the remaining 6, 11 spent at least some time in the community during their infectious period. 5 remain under investigation, so I can't confirm for those people today. So I know that 1 person in quarantine for their entire infectious period does sound very concerning, and of course it is something that we're really looking at as well. But it's important to remember that we're still interviewing the remaining 5. And so hopefully we'll have more to say about that tomorrow. So to 8 o'clock last night, we have 12 people in our hospitals. 2 of these are in ICU, and 2 both of them require ventilation. Of the total 12, 7 are unvaccinated, 2 have received 1 dose. 1 is fully vaccinated, they're not in ICU, and 2 are unknown. Of the total 12 in our hospital, the youngest patient is under 12 years of age and the oldest is in their 90s. So we now have over 850 self-identified close contacts and over 430 active exposure sites. And as Dr. Karen Coleman continues to remind everyone, please keep up to date with those exposure locations on the ACT COVID-19 website and continue to check in with your Check In Canberra app. So yesterday you'll recall that the Corwell Early Childhood Centre was added to our exposure site as a casual contact location yesterday. Following some additional interviews and analyses, this site has now been upgraded to a close contact location. So those individuals will be messaged, but please have a look closely if you attend the Corwell Early Childhood Centre on the webpage. I'm pleased to say that we now only have 3 active sites of public transmission. KFC Dixon, Priceline Pharmacy Woden, Murchie Indian Restaurant and Bright Bees Early Learning Centre have all been removed, as there's been no ongoing transmission at these sites for at least 14 days. Our remaining 3 active sites are Busy Bees Childcare, Bid Food Canberra and Ainslie Village. So today my shout out is to our amazing planning team in the Health Emergency Control Centre, As I'm sure you can imagine, planning the response for a pandemic has many moving parts. It obviously preceded this current pandemic that has evolved over the last 18 months as well. Even when we think we have considered all that the pandemic can throw at us, something changes and we need to pivot and adapt. And the planning team has been able to do that very ably and have proceeded to action the changes we need to make. This team does all of our operational planning, helps to engage across various non-government sectors and government agencies, undertakes policy development and many other reporting mechanisms. So during this current outbreak, since August 2021, the team's led over 170 incident management meetings and activated a dozen of operational plans to support our community. So I want to thank them for all they do to keep this response moving forward. Thanks very much.
Good afternoon. As the Chief Minister indicated, I just want to touch on the announcement that was made today pre the ACT budget, which will be released in early October. So today we're announcing major steps towards delivering nursing and midwifery ratios across our public hospital system. Ratios guarantee that there will be more staff on wards to care for patients. As the Chief Minister indicated, we're backing this in with a significant investment to recruit additional nurses and midwives across Canberra Health Services and Calvary Public Hospital in Bruce. Hiring more than 90 full-time equivalent additional nurses, permanent nurses and midwives will be a big boost for our health workforce and help to provide better healthcare for Canberrans. This funding will improve our health system and deliver better outcomes for patients and a safer workplace for our nurses and midwives. Recruitment to the new positions will begin later this year. I think we're all aware that the pandemic has reinforced just how invaluable our frontline health professionals are. They've been diligently caring for COVID-positive patients, as well as playing a critical role in our COVID response through testing and vaccination, and of course, continuing to care for all of the other patients and families that are in our hospitals throughout the pandemic period, and managing the anxiety that goes along with that. The minimum ratio for nurses and midwives to patients will depend on the clinical setting. So we've agreed with the Australian Nursing and Midwifery Federation that the first phase of ratios will focus on general medical, general surgical, acute aged care and adult mental health units. So again, we will be recruiting 90 full-time equivalent permanent nursing and midwifery positions to meet our election commitment to deliver ratios, and starting in a phased approach with recruitment beginning later this year. This commitment will also contribute to a more sustainable workforce by reducing staff fatigue and increasing job satisfaction across our health and midwifery workforce. And I want to particularly thank the Australian Nursing and Midwifery Federation for working closely with Canberra Health Services and Calvary Public Hospital Bruce, and in partnership with the ACT Health Directorate, on establishing the ratios framework and the process for implementation. And this will be formalised through the enterprise agreement, which will be going out for ballot shortly. Before I hand back to the Chief Minister, Canberra Health Services has just asked that I touch on a rumour that is circulating on social media that anyone can turn up at the hospital today and get a vaccination. This is not the case. There is a vaccination clinic running at Canberra Hospital today, but it is for staff and vulnerable patients only. We currently have significant visitor restrictions at Canberra Hospital, and this is not a public clinic. If members of the public do present to Canberra Hospital for a vaccination, you will be turned away. So we're sorry to see that that has been incorrect information has been circulated on social media, but we thought it was important to correct that as quickly as possible. For details of how you can book a vaccination through ACT Government mass vaccination clinics, please visit the COVID-19 website, covid19.act.gov.au. And with that, I'll hand back to the Chief Minister.
Thank you, Rachel. Questions?
Hey,
Hello.
so I know that you've gone over your stance on our roadmap, but in light of any of the feedback from the Canberra community about people believing that it has a lack of detail, have you taken any of that feedback on board and has anything changed?
Yes, we've certainly heard from a variety of people who want more information and we'll be providing that in due course, yes.
So still at the end of the month?
Yes.
Are we able to get an update on the number of businesses who have applied for the support grants? How many have been approved and how many are pending?
Yes, so we will tick over nearly 3,000 businesses paid and $50 million paid out later this afternoon. The number of applications received is a little over 8,000.
How many businesses have been rejected?
131 of those assessed so far. There are still 2,459 applications awaiting further information.
And a couple of weeks ago you mentioned about a third, I think, needed more information to be processed. Is there an update about how many applications had to be sent back or need more information or weren't filled out correctly? 2,459 applications needed further information. As a percentage of total applications, that would seem to be about a third.
Has there been any word from the Commonwealth about securing a different proportion of doses for mass vaccination clinics in the ACT since yesterday?
No.
I've got a question for the Acting Chief Health Officer.
Sure, unless, are there any more for me? And then, yes, we'll go to questions for others.
Last Friday, you asked your national cabinet colleagues to explain whether greater freedoms for vaccinated people would be temporary or permanent. Were your concerns addressed at National Cabinet? And is National Cabinet going to revisit the vaccine passport issue, or is it now a case of every state and territory for themselves in terms of what the rules are?
I think it's every state and territory for themselves. The indications, most were silent on the issue in terms of what they would do. New South Wales, for example, have not provided any detail beyond their initial 70% requirements. In Victoria have laid out some differences at 70 and 80. I don't think anyone has gone on the public record to say that they intend to make these permanent discriminatory measures. So one would hope that they would only be temporary in jurisdictions that do adopt them.
And does that mean that the Tasmania, Victoria, Northern Territory working group that was examining that issue, is that process over, or is that something that's going to continue to be considered at future meetings?
It's still to be considered. I think it would be fair to observe that there was a bit of a Commonwealth takeover of that process, and a paper presented a couple of National Cabinet meetings ago that none of those jurisdictions had any authorship of, so that was pretty frustrating. And so the issue has been held over. I would anticipate something coming back to the next National Cabinet meeting, which is 1 October.
The vaccination passport in New South Wales is starting to expand to the region. Have you had any conversations with your with the New South Wales counterpart about Canberrans who either haven't had the opportunity to be vaccinated, can't be vaccinated? Do they fit into the unvaccinated category or the vaccinated category? How's that going to work between what's happening here in the ACT and the surrounding regions when the passport expands?
So I understand New South Wales will have some provision for people who can't get vaccinated. I don't think they're going to have anything in place for people who might have a vaccine booking or have had one dose but are not fully vaccinated. But these are questions you should definitely put to John Barilaro.
And then just as a follow-up, I will put them to the New South Wales government as well. What happens to people arriving from overseas who are vaccinated with, say, Johnson & Johnson, but are unable to get a vaccination passport because it's not registered by the TGA?
I don't know. You'll need to ask the Australian government that, because they'll control the internal arrivals into Australia and presumably would have discussion with the jurisdiction that would be their port of entry as to what the rules would be there. So that's, obviously there won't be any direct international flights into Canberra, so people who are coming back into Australia will come back either through Sydney, Melbourne, Brisbane, Adelaide or Perth, presumably.
Following the protests yesterday, the Australian Council of Trade Unions raised concerns that there was a far-right infiltration of the union movement. As a Labor leader, how concerned are you by that happening in the ACT, even though mandatory vaccinations may not be such an issue in this jurisdiction, but that presence within the movement? I'm not sure that I'd characterise it as far-right infiltration of the union movement, far-right infiltration of the protest movement, clearly, and no, very little concern in the ACT. We're not exactly a hotbed for far-right activism.
Chief, Dr Coleman yesterday said that COVID-0 is now unlikely. Is that also your view? And how concerning is it that we had at least, looks like only one in quarantine during their infectious period?
Well, Dr Coleman is best placed to provide advice on the epidemiology. And yes, it is concerning that there would be this many people infectious in the community at this point. Having said that, the current public health restrictions act as a buffer against that increased risk, because we don't have tens of thousands of people moving around and meeting up with each other and spreading the virus to each other at the moment. I guess it's a timely reminder that we have 3 tools at our disposal to fight this virus. One of them is vaccination. That's going pretty well. But we definitely want to get that program delivered as quickly as we can. The other 2 tools, test, trace, isolate and quarantine, that's only partially effective given the data we've got day on day, and so the public health measures are the other tool that's protecting the community and ensuring that we're not getting exponential growth in new cases.
Minister, we've seen some discrepancy between the amount of Pfizer that you've said we're going to receive and that it wasn't as high as you would have liked, and some figures coming out of Zed Selja's office. Are you able to provide some data or some detail about how many we are expecting to receive, how many you wanted to receive, and roughly what that per capita allocation is?
Yes, we can do all of that, but I can't do it from the podium.
Have you looked at any modelling about how many daily cases we might expect once we gradually reopen at different vaccination rates?
Yes, so the best data that was available on that was presented to National Cabinet. It modelled daily infections through the full course of a high-seeded epidemic, which is what we would be in, introduced at 70% 2-dose vaccine coverage, assuming partial TTIQ, which is a fair assumption, but what would be deemed continuous low public health social measures, so sitting slightly below where we are now, and that when seeded into a population of 500,000, which is slightly above the ACT's population, that you would see daily new infections peak at around the 2,500 mark. Now, we won't have low PHSM at 70%, and our population isn't 500,000, it's about 435,000, so you can make some adjustments there, but the expectation would be that case numbers would not be between 10 and 30 in an environment where you opened up at 70%. It would be significantly more than that.
And sorry, just to follow on from that, and we're confident that our health system can cope with that?
No, not with that, definitely not. That's why we're not opening up at 70% and we're not having low public health social measures at 70% double dose.
So what would be a realistic figure then for our health system to be able to cope?
Well, on the basis that around 10% of all cases will end up needing hospitalisation, then we are not in a position to sustain thousands of new cases each day. We will need to keep that number considerably lower, and preferably less than 100.
Is there a number that's been modelled?
No, there's not an exact number. There's a range,
Yep.
but we don't have unlimited hospital beds and we don't have unlimited intensive care capacity, and we have to factor in New South Wales. Now, we've already got patients from New South Wales in hospital in Canberra because there's nowhere else for them to go.
What's the range?
Sorry, what's the range?
The range you mentioned.
Well, we've got a capacity to scale up at the surge centre. We can take our intensive care beds up into the low hundreds. The constraint is staff, and the constraint, of course, is then what's happening in surrounding New South Wales.
There's a bill in the federal parliament to protect national cabinet deliberations and the secrecy of those from freedom of information laws. Given the statement National Cabinet put out about the importance of the secrecy of deliberations on Friday, do you support that bill, or do you think it's concerning that there'll be permanently less transparency on National Cabinet than there was on COAG?
Yeah, so look, we had this discussion in National Cabinet. I pushed for a requirement that there would be a communique at the conclusion of each meeting that would outline decisions taken by the National Cabinet, so that was made available as soon as possible after the conclusion of each National Cabinet meeting. In relation to release of information, look, the Prime Minister's office backgrounds the media ahead of every meeting. I read about what's going to be coming forward to National Cabinet in the Australian and the Financial Review pretty regularly in advance of even seeing agenda papers. I understand the agenda is freely circulated amongst the Federal Press Gallery, and the morning of the meeting you can be pretty well certain that what's going to be talked about is out there publicly. I have made a habit of talking about things from this podium. I know my state and territory colleagues have as well. There are some matters clearly that are not resolved in one meeting and so do need to be dealt with over a series of meetings and do require confidentiality of those discussions, but it is my view that once a decision is reached, it should be publicly announced, and it's entirely appropriate for questions to be asked on how that decision was reached. But I also think it is reasonable that we do have the opportunity to take more than one meeting at times to consider issues. So I draw the distinction between a decision being taken and a decision being under consideration. But what I would say, generally speaking, is that given you've got 9 different governments sitting around that table of all different flavours of political philosophy with a variety of different world views, there's not much that's gone on in National Cabinet that hasn't been either extensively discussed in the media, often before meetings, and all the pre-positioning that goes on. So, look, to be frank, there's not that many things there that would be considered so secretive as to not be able to be pretty freely discussed. So the legislation, possibly a solution looking for a problem.
The Doherty modelling makes some assumptions about test, trace, isolate, quarantine capacity as case numbers increase, and that with higher case numbers it will be partially effective. I am interested in your assessment of TTIQ capability in the ACT at the moment, given the number of cases that are still active for some part of their infectious period in the community. Can we say that TTIQ is even partially effective at the moment in Canberra?
Yes, we can say it's partially effective because we are able to get people, some, and a proportion, and a reasonably good proportion most of the time, are in isolation or quarantine throughout their infectious period, but we're also able to reduce the number of days that people are infectious through testing. And so that's why, in my opening remarks, I pointed out the importance of getting tested earlier, as soon as you've got symptoms, because then the number of days that you are infectious in the community is less. So whilst I appreciate we are presenting a binary of either entirely in quarantine or infectious in the community, there's a spectrum. There's also a spectrum of risk amongst those who were infectious in the community. Were they wearing a mask? how many different places did they go to? Were they in an essential work role where they were engaging with hundreds of people, or were they working in an office by themselves, nowhere near anyone else? So there's a spectrum of risk too associated with those who are infectious in the community. So the principal barrier at the moment is that you are infectious often before you have symptoms, and then some people are waiting several days after their symptoms have developed to get tested. So one of the things we can do to try and close the gap in terms of number of days infectious in the community is get people tested as quickly as possible. One of the worries moving forward is that fully vaccinated people, a lot of them will be asymptomatic. They'll be carriers of the virus and they'll infect other people, but they won't even know they've got it. And so that's where there will be an increased role for rapid antigen testing in future phases, because that would at least provide another layer of surveillance that has a quicker turnaround test. It's not as accurate as the PCR testing, but it could at least potentially screen out more people who are asymptomatic, fully vaccinated spreaders of the virus. We've then got to hope that those people who are fully vaccinated do actually quarantine. And so this is another area that I think is going to be challenging across Australia. It's why I've addressed this point on a number of occasions from this podium, is that the obligations around protecting other members of the community, other members of your own family, don't end when you're fully vaccinated. You can still get the virus. You're not going to get very, very sick and find yourself in ICU. Mostly, there's very few fully vaccinated people. There are some, but very few. But you can still get COVID and you can still spread it to other people. That's just a fact.
Given that, and by all accounts, the modelling shows that as we begin to open up, even with the vaccination threshold, we will see hospitalisations, we will see deaths. While no death is acceptable, what level of risk would you be prepared to I guess, begin open up at or accept?
Yeah, I would prefer there are no deaths, Dominic, but that may not be possible. But what I do want to do is give everyone the opportunity to get vaccinated. And I'm confident that Canberrans will take up that opportunity. I'd like that to be sooner rather than later, and so that's one of the reasons why we're having the discussion with the Commonwealth about what we can do to get some more supply into our mass vaccination clinics, because at the moment they've got their bookings out until the 27th of October. So anything we can do to get more supply could bring those forward. The more people we can get vaccinated more quickly. But this is the dilemma that every single jurisdiction is facing. Now, it's a challenge. It's a very difficult question. What we need to do is ensure that we get as many people vaccinated as quickly as possible as we gradually ease out of restrictions. But just so that this is not misinterpreted, that's not to say that we will not be making and easing restrictions gradually over the next month. Whilst we still have people getting vaccinated, we will be doing that. So we do accept there is a level of risk, but I'm doing everything I possibly can to minimise that risk, to get as many people vaccinated as possible. And that's what we want to do. That is our focus right now. Now, people who choose not to get vaccinated for reasons other than medical conditions, which prevent them from getting vaccinated, are taking a massive risk. And so I think there does come a point at which we can say that everyone who wants to get vaccinated has been given the opportunity. And that moment is coming, but it's not before the 15th of October. Any other questions for me?
The Deputy
Yes, okay.
the Chief Health.
Thank you.
Hi.
Hi.
Hello. So we've seen a number of new exposure sites that are on the public transport network on bus routes. That's over 5 days. Does that indicate that a bus driver was infectious for 5 days at work?
So I'm not at liberty to identify whether that was a bus driver or a traveller. That's potentially identifying information for that individual. So I'm not going to reveal that because of privacy issues.
Well, can I ask then if it's had any repercussions for the public, the transport network, like in terms of staffing or?
No, not to the best of my knowledge.
And the Chief touched on this briefly, but just say there are people in Canberra who are fully vaccinated, but they might have a family member or a friend who's just adamant about not getting the vaccine. But then that person who's fully vaccinated is terrified about when we gradually reopen, about carrying COVID and passing it on unknowingly. What would you say to those families? What's the advice? How can you have a conversation, or what would you say to them?
So I think we've got some really fantastic resources on the ACT government website and the Commonwealth government website to try and open up those discussions. So first, it's about if someone actually doesn't have a medical contraindication to getting vaccinated, it's I guess beholden on us as family members and friends who are really worried about that person's circumstances to try and open up that conversation in as non-threatening a way as possible and try and understand what the concerns are. And then there are some terrific resources to try to sort of myth bust some of those concerns. And obviously there's a lot of misinformation out there on COVID and a whole range of matters at the moment that can sort of be promulgated through social media. So we understand that it can be really hard for people to access the most accurate information. So I would suggest to those people to go to the trusted sources of information, seek that out, even talk to their GP about how they might be able to have that conversation.
Are we seeing transmission through masks, or is public transmission happening because people aren't complying with some of the orders out there, like we are hearing about every day when it comes to businesses and employees?
Yeah. Well, I guess masks aren't a panacea against any transmission, particularly if they're not used as they're intended to be used. So there's a great video on our social media about how to use masks, how regularly to change them. The fact that you've really got to consciously think about not touching and contaminating your face. That's quite hard for all of us to do over a period of time. So they aren't a panacea. What we do know that transmission is far less likely for people in those essential roles that do contract COVID that are appropriately wearing masks, and we're seeing that time and time again. There are some scenarios where mask wearing is challenging, and I'm thinking about particularly early childcare and kids ripping masks off teachers and things. So, you know, there are those instances where it's just harder to abide by that. But in the main, you know, they are a safeguard, but they're not a panacea. Yeah.
Is there any evidence in the ACT, even 1 or 2 cases, of transmission occurring outdoors?
I think I can't give you the full figure, but certainly we have seen some in very few instances. And again, it's in the scenario where people are spending prolonged periods of time together very close and may not have been wearing masks all of the time.
Dr. Johnson, there's been cases of ACT police conducting compliance checks on faith communities, yet apparently turning a blind eye to other public gatherings, and that would appear to be a case of an inconsistent approach. What would you like to say to people of faith communities about those sort of perceptions? So
I guess it's a matter for ACT Police to talk about the range of compliance activities that are going on, and obviously it's not just ACT Police, it's Access Canberra, it's Health Protection Service, so there's a whole compliance regime. And so I'd probably disagree with the assertion that those compliance officers are potentially targeting a particular sector of the community, and I know that they've done blitzes on outdoor gatherings, mask wearing by individuals and in businesses, and because there is no indoor gatherings allowed at this point in time, they're conducting checks right across the hospitality sector and a whole range of community sectors. So I'd probably take an issue at the assertion there. We know that this is really a really challenging time for all of us in the community, and particularly those people of faith who like to attend weekly church services. You know, myself, I belong to an Anglican church, and now I regularly Zoom in on the weekends. So I guess, but at this stage, as the Chief Minister has said and Dr Coleman has said, at this stage, because of the level of community transmission that we have ongoing, because there are many people in our community that still haven't had the opportunity to be vaccinated, we just are not at a point in time where we can allow those gatherings indoors, except for those very time-critical events that we recognise when there's needs to be administration of the last rites or baptism before the end of life.
Thank you for that response. And could I have a follow-up question? Moving forward, obviously the ACT government has a very high priority attached to mental health during the lockdown.
Yeah.
There is a very, very close connection between mental health, spiritual health and so on.
Yeah.
Are you consulting with faith communities moving forward?
So we consult with communities across the spectrum. So yes, certainly, and we regularly receive submissions from different faith communities as well as other sectors of the community about what they would like to see going forward. And we can certainly anticipate, as we come out of lockdown, as we did last year, that we will start to be enabled to gather in small numbers, first of all, at church and at the mosque and in other faith settings, and then slowly build on that as we get more confident in our vaccination rates. Thanks.
Do you have more? I've just got one for the Health Minister, if that's okay. Oh, yep.
Excellent, thank you.
Minister, in regards to the workforce boost, is the 90 additional staff in, I suppose, on top of the annual graduate intake, and is it 90 nurses and midwives or just nurses?
So it's 90 nurses and midwives combined, full-time equivalent positions and permanent positions over, and so the funding of $50.1 million is over the 4 years of the budget period to recruit those. We won't be able to recruit 90 nurses and midwives all at once, so it will be a staged recruitment that will start later this year, working through both Canberra Health Services and Calvary Public Hospital, and it will be a combination of new graduates additional to the graduate intake we would have otherwise had, which we do every single year, so we increase nursing numbers through graduates every year, but also more skilled nursing staff as well. So there'll be a range of recruitment measures that are put in place. We know that some will be easier to recruit to than others as well. So one of the areas that is in phase 1 is adult mental health, and we know the importance of recruiting skilled mental health nursing workforce, but also some of the challenges that are around that. So there'll be particular recruitment effort put into that area.
Minister, if I could briefly ask about the future of the health co-op,
Mm-hmm.
Is it going to go to a pay per visit model, and how will that affect people that are on lower incomes who relied on the subscription fee, because doctor fees can be pretty expensive?
Yeah, so just to provide some background for those who are watching in relation to this issue, so the National Health Co-op has gone into administration previously, and the administrators advised members of the National Health Co-op yesterday that they had entered into contracts for the National Health Co-op's clinics at Coombs, Evatt, Higgins, Kippax and Macquarie to be restructured into 5 independently owned and operated GP clinics, and that change to take effect from the 2nd of October, and yet to enter into a final arrangement for Chisholm and continuing conversations with ANU. So just as background for people who are watching, in response to your question, each of those individual clinics will make their own arrangements. I expect that the majority of them will be mixed billing, but that is really for them to discuss. I would note that Palm Healthcare is the purchaser of 2 of those clinics. I believe it's Kippax and Coombs. They already operate a clinic in Greenway, which indicates on its website that it does provide some bulk billing services. So I am hopeful that at least some of the services will continue to be bulk billed. I think this is a really good outcome compared to what we were potentially seeing of all of those national health co-op clinics potentially shutting down. So to see new general practice clinics being established and maintained, and a continuity of service with patient files being transferred to these new clinics is a really positive outcome. But I would be very surprised if any of them were 100% bulk billing, because we know how challenging a 100% bulk billed environment is, particularly in the ACT, particularly in an environment where the bulk billing incentive has been removed from the ACT, despite the fact that we have the lowest number of GPs per head of population or per 100,000 population of any jurisdiction, and far lower than any other metropolitan area. So, you know, we continue to have those conversations with the Commonwealth about the sustainability of general practice generally, and the availability of bulk billing, which is also very low in the ACT compared to other jurisdictions. So, look, I think this is a good news, bad news situation for those National Health Co-op members. 30,000 Canberrans at least can be assured that there will be continuity of service for them, that their patient files will be transferred, that the clinics that they go to, by and large, will be providing a continuity of service. But the extent to which that service remains bulk billed will be something that will be a matter for each of those individual practices going forward. Jasper.
Minister, the ACT Health is investigating bringing more staff back to the office to work on essential projects. Does that mean other employers in Canberra are now at a juncture in the outbreak where they could look to bring more people back to the office as well, given it's about workers being essential? Is it time people can look at reclassifying people as essential?
So I think there is an extent to which something that might not have been essential to be done within a 2 or 3 week period for the initial part of the lockdown might start to become more and more urgent to restart work on particular projects. So there are some additional ACT Health Directorate staff that the Directorate is starting to consider how to bring back to the office safely in a COVID-safe way, but staff are all being consulted about whether they're able to come back to the office, whether they have caring responsibilities that would mean that it would be difficult for them to return to the office, and how to do that safely and what they would need in order to feel safe. Obviously, we're in the ACT Health Directorate main building today, and there are dozens of staff working across this building already because they provide essential response to the pandemic. There are other essential projects that must continue to support our health system, and those are the things where staff are being consulted about how some of them at least may be able to return to the office safely, so that we can ensure that those projects continue in a timely fashion.
And it would then be appropriate for other employers, government and non-government, to be making similar considerations about their workforces? It
is part of the public health direction that essential work can continue in an office environment. Certainly the Commonwealth Government has made a range of decisions about who needs to be in the workplace and who can work from home, as has the ACT Government made those decisions. And it's not only the Health Directorate, other directorates have some staff still in the office because those essential services, and as Minister for Child Protection, there are child protection staff who work in the office because that is absolutely an essential service, some of which can only be done from that office environment. So that will be the case across a range of undertakings. And again, people might make different decisions about what's essential to be done in the office in week 5 and 6 than they might have made in week 1 or 2.
Sorry, just one more for the Chief Minister about business, if that's okay.
Well, it's okay with me.
Sorry to bring you back, Chief.
Always a pleasure answering your questions, Dominic.
Thank you. Just quickly, we've heard that the federal government, when they were writing the checks for the business support grants, that they only required a genuine ABN, but extra caveats were put in place by the ACT government, not the federal government. Is that correct? And if so, how come we've taken a different path to the other states and territories?
So we did work with the Commonwealth on the design of the scheme. We have put in place the requirements that we believe are necessary to avoid fraud.
And how come we decided to take that path, when New South Wales and other jurisdictions didn't?
Because both New South Wales and Victoria shared their learnings from their business grant schemes last year. They were also audited by the respective state Auditor Generals, and the very clear advice that was discussed at the Board of Treasurers, which is the meeting of all the state and territory treasurers, was that there were significant fraud risks and that there were some ways to avoid those, and we've put them in place.
And then have we got the balance right? Because we hear a lot of businesses saying that they are struggling because they haven't got the support in time.
Yes, we have got the balance right. Thank you.